September is National Atrial Fibrillation Awareness Month. KCTV5's Carolyn Long helps you identify the signs, symptoms, and the latest treatment options for the most common rhythm disorder of the heart.
A lot of people have atrial fibrillation, but unfortunately they don't know about it.
Dr. DJ Lakkireddy is a cardiologist specializing in electrophysiology at Kansas City Heart Rhythm Institute at HCA Midwest Health. He defines atrial fibrillation, or AFib, as a malfunction of your heartbeat, often creating a rapid rhythm. So when you're in AFib, the upper chambers of the heart are out of sync with the lower chambers. If left untreated, AFib can be very concerning.
Sometimes patients will present with no other symptoms other than a massive stroke and an episode of really bad congestive heart failure and things like that. So between stroke, heart failure, dementia, and a great compromise in quality of life, atrial fibrillation is a terrible disease to have, and we have to do everything to find it and fix it.
Now, you said a lot of people have it and don't even know it. How do you identify it?
Many times people have symptoms of palpitations, and you go to your doctor's office, they do an EKG, and then you end up finding arrhythmia. But a lot of times people do find out in a very sort of innocuous way, where you go to a doctor's office for something else, and then they do an EKG. They end up telling you, oh, by the way, you have atrial fibrillation. But some patients are really not that fortunate, and they may end up with strokes and heart failure episodes even before they realize it.
If you have diabetes, sleep apnea, hypertension, are obese, smoke, or even drink moderate amounts of alcohol, it might be worth monitoring your heart rhythms through your Apple Watch or other digital health monitors on the market.
So what are the symptoms? If someone watching right now says, gee, I don't know, I've heard this in my family, but I don't know if I have it. Is this something that you might feel?
Absolutely. I think a vast majority of the patients will actually have symptoms of palpitations, or like rapid heartbeat, or butterflies in your chest, waking up the middle of the night with skipped heartbeats and things like that, right? And some people may simply feel more fatigued and tired than usual. They may not have palpitations, right? And some people may just feel wiped out all the time. Oh my God, it's like most of the times people think that, oh, this is just my age and I'm getting older.
Okay, so once you determine that, yes, indeed, I have AFib, what can be done about it? What are the treatment options?
So knowing what we know about the arrhythmia, I think first and foremost thing, it's important to protect someone from the risk of stroke, right? That's the most dreaded complication. So there are medications called blood thinners that you could take to protect yourself. And there are medications to slow down the heartbeat so that your heart is not running around 150, 200 beats per minute. So you're basically running a marathon sitting in your chair. And also medications that could actually suppress this arrhythmias. And now there are procedures called the cardiac ablation procedures that you can do to fix this atrial fibrillation so that you don't have to be on medications forever, and also mitigate the complications of the disease itself.
Dr. Lakkireddy is also proud to offer newer breakthrough treatments if medications don't work. Many minimally invasive, as long as you catch it in time.
Dr. Lakkireddy, thank you so much for joining us.
Thank you very much for the opportunity, Carolyn.
For more from HCA Midwest Health, you can go to our website, kctv5.com, and click on It's Your Health.